And when Moreno was dealing with patients, have you seen an average of time that should take a treatment?
Yeah.
How do you see that time perspective?
I think that the ideal setting will be, well, whatever the patients can take, because some have, you lose some if you make it too long. They get tired and weary, and they go dreaming off somewhere, or they leave. So Moreno was very cautious not to exceed the time limits that they had. And that's not the only way to consider time. How often do these patients need a session? Because we may not always be able to give them daily sessions, and in fact we found some patients couldn't take daily sessions. They were still working on what had happened yesterday, hadn't integrated it yet. I had one patient who would never do more than one session a week. And at the end of that week, when she came again, she would go over what she had experienced in that week. Mm-hmm. And it was a complete report. And I asked her, would you like to see me more often? She said, I couldn't do it, I couldn't digest it. The average was twice a week for most patients. Some patients relapse a bit in between sessions. And it kept them at the level where they were when we did it twice a week. But there's great variation even in what a patient can take in. So again, that's the director's assessment of the situation. That's part of being mm-hmm. a director. How you use your therapeutic time and how often. Mm-hmm. But on an average, 2 a week did the trick. And for those patients who couldn't take it, we just didn't let them come once a week. But the majority, in order to keep them on an even keel of what they had gained, twice a week was satisfactory.
Mm-hmm. So I remember that when we talk about Freud and the psychoanalysis, the duration, if I'm not wrong, he said something that one analysis should not last for more than, let's say, 18 months. Now we see that psychoanalysis lasts sometimes forever. No? How do you see this question of extending?
Well, the question is it for the patient's benefit or is it for the therapist's benefit? Is this an economic source of economics of his finances? The problem with psychodramatists is that they lose the patients very fast because they heal them so fast. They have great turnover. Mm-hmm. But it's not only analysts who take a long time, by the way. They've also started to abbreviate. It's the Jungians. They go on forever. Mm-hmm. I had an experience with a woman, I did not know she had been in any other form of therapy, and it was in a professional setting. I did a session with her, and it was just a weekend. About a month later, we went to the American Psychiatric Association conference, and a gentleman comes up to me and said, "You're Mrs. Moreno." We had a booth where we had with a couch where people would come and sit and talk to us, and we had displays of our books and magazines and information about our training. Mm-hmm. And this nice, very handsome young man, I would say not young, 50-ish young man. 50-ish young man, to me everybody younger than me is young, stood by the booth and he said, "You're Mrs. Moreno, aren't you?" I said, "Yes." He said, "Could I talk with you? Could we go downstairs and have a drink?" Because you had to close, the exhibits were closed after 5 o'clock, and there was a security measure. And this was just before 5. So I said, "Yes, I don't drink alcohol, but I'll have a glass of orange juice." He said, "Fine." We go down, and we sit down and talk a little bit, and he said, "I wanted to talk to you because you have been able to do in one session what I couldn't accomplish in 2 years." So I said, "Yes, but wait a minute. Maybe you got her ready for it." You know, how do we know? Mm-hmm. But I accomplished what he hoped she would accomplish in 2 years, in one session. So, How do we assess how ready a patient is for something? And then we also, and that's Moreno's whole point, that verbal therapy doesn't do it as deeply, as profoundly, and as fast as action therapy, because of the action portion.